Are you tired of feeling overwhelmed and unsure about how to properly care for your baby? Do you worry about making common mistakes that could harm your little one's health and well-being? As a new parent or caregiver, it's natural to have concerns and doubts. But don't worry, we're here to help. In this video, we'll be discussing the most common baby care mistakes and how to avoid them. From safe sleep practices to proper diapering techniques, we'll cover everything you need to know to give your baby the best care possible. So if you want to feel confident and capable as a parent or caregiver, make sure to watch this video till the end. Make sure to subscribe to Yardy Baby for daily baby-related tips and tricks. As a new parent or caregiver, it's normal to feel overwhelmed and unsure about how to care for a baby. It's important to remember that everyone makes mistakes, and it's okay. The important thing is to learn from them and do our best to avoid them in the future. In this video, we'll be discussing the most common baby care mistakes and how to avoid them. 1. Not following safe sleep guidelines. It's essential to follow safe sleep guidelines to reduce the risk of SIDS, sudden infant death syndrome. Always place your baby on their back to sleep. Use a firm and flat surface, and avoid using soft bedding or placing toys in the crib. Make sure to use a properly fitting crib or bassinet, and avoid placing your baby on soft surfaces such as a couch or armchair. It's also a good idea to keep the room at a comfortable temperature, around 68 to 72 degrees Fahrenheit, and ensure that your baby isn't too warm or too cold while sleeping. 2. Not sterilizing bottles and pacifiers. Proper sterilization is crucial to prevent the growth of harmful bacteria. Boil bottles and pacifiers for at least 5 minutes, or use a microwave or electric sterilizer. If you're using a microwave sterilizer, make sure to follow the manufacturer's instructions carefully. If you're using a dishwasher to sterilize bottles and pacifiers, make sure to use the hot water and heat drying cycle. It's also a good idea to replace pacifiers every few months to prevent the risk of infection. 3. Not checking the temperature of bath water. It's important to make sure the bath water isn't too hot for your baby. Use a thermometer to check the temperature and aim for around 98 to 100 degrees Fahrenheit. If you don't have a thermometer, you can test the water with your elbow or wrist to make sure it's not too hot. Avoid using hot water from the tap, as it can vary in temperature and may be too hot for your baby. It's also a good idea to keep the bathroom door closed to prevent drafts and keep the room warm and cozy for your little one. 4. Not following proper diapering techniques. To prevent diaper rash, make sure to clean your baby's bottom thoroughly and apply diaper cream at every diaper change. Use a soft, wet cloth or wipes to clean your baby's bottom, making sure to get all the creases and folds. Avoid using wipes with alcohol or fragrances, as they can irritate your baby's sensitive skin. After cleaning your baby's bottom, pat it dry and apply a thin layer of diaper cream to create a barrier between the skin and the diaper. Avoid using too much diaper cream, as it can make it difficult for the diaper to absorb moisture. Make sure to change your baby's diaper every 2 to 3 hours to prevent irritation and diaper rash. 5. Not burping your baby. Burping helps to release gas and prevent your baby from getting uncomfortable. Try burping your baby after every feeding and during breaks in between. There are several different burping positions you can try, including sitting your baby on your lap and patting their back, holding your baby upright and patting their back, or placing your baby over your shoulder and patting their back. Experiment with different positions to see what works best for your baby. 6. Not washing your hands before handling your baby. It's important to wash your hands thoroughly before handling your baby to prevent the spread of germs and bacteria. Use soap and water and scrub your hands for at least 20 seconds, making sure to get between your fingers and under your nails. If you're not near a sink, you can use hand sanitizer to clean your hands. Avoid touching your face or other surfaces before handling your baby to prevent the risk of infection. 7. Not using car seats properly. It's essential to use a car seat every time you travel with your baby to keep them safe in the event of an accident. Make sure to follow the manufacturer's instructions for installing the car seat and securing your baby in it. It's a good idea to practice installing and using the car seat before your baby arrives to ensure that you know how to do it properly. Avoid placing the car seat in the front seat, as it's not as safe in the event of a crash. 8. Not following recommended vaccination schedules. Vaccinations are an important part of keeping your baby healthy and protected from serious illnesses. Make sure to follow the recommended vaccination schedule for your baby and discuss any concerns you may have with your healthcare provider. Vaccinations can be given at the same time as other well baby visits, so it's a good idea to schedule these visits in advance. 9. Not using sunscreen properly. It's important to protect your baby's delicate skin from the sun's harmful rays, especially during the summer months. Use a sunscreen with an SPF of at least 30 and apply it to your baby's skin 15 to 30 minutes before going outside. Make sure to apply it to all exposed areas, including the face, neck, arms, and legs. Avoid using sunscreen on your baby's hands, as they tend to put them in their mouth. Reapply sunscreen every 2 hours or after swimming or sweating. 10. Not using the correct dosage of over-the-counter medications. It's important to use over-the-counter medications, such as acetaminophen or ibuprofen, carefully to prevent the risk of overdose or adverse reactions. Make sure to follow the dosage instructions on the label and use the appropriate dose for your baby's age and weight. Avoid giving your baby adult medications, as they can be harmful to their developing bodies. If you have any concerns about giving your baby medication, consult with your healthcare provider. By following these tips and being mindful of common baby care mistakes, you can ensure that your baby is safe and well cared for. Don't be afraid to ask for help if you're unsure about something, and remember that every parent makes mistakes. If you found this video helpful, make sure to hit the like button and subscribe to our channel for more baby-related tips and tricks.